Hi, this is Dr. Tory McJunkin. I wanted to talk to you about annular tears or disc tears. Disc tears cause pain that occurs typically across the area in a band-like fashion where the disc tear occurs. You can have tears in your disc at any level in your spine, your cervical, thoracic, and lumbar. Lumbar disc tears are probably the most common, and typically we talk to people that it seems like they have a belt of pain around their back, and that oftentimes will be a kind of a lower level lumbar disc tear, so maybe like L4 or L4-5 or L5. Those levels in the lowest area of your spine can cause that. Sometimes people can get radiation of the pain also. You can have radiation into the buttock area, into the hip area, and sometimes even down the leg. Now I'm going to talk to you about the disc itself. I always tell people that the disc is like layers of an onion. And so you have this concentric layers of an onion that go around and around and around. And inside the center of the, and that's called the annulus, the outside layers. Really tough, made of collagen fibers that keeps everything inside. The inside part of the disc is called the nucleus propulsus. And it really is like the jelly or the shock absorber in your shoes. I'm going to show you a picture of the disc. This is from Nikolai Bogduk's book, talking about the anatomy of the lumbar spine. But I'm going to show you what that looks like right here. So, these are all my highlights, so apologize for those. But this is what the disc looks like, and you can see those layers that just go round and around, and that's the annulus fibrosus, or the real tough part. This is a cross section of the disc. The inside here is the nucleus propulsus, and that's the real jelly-like material. This is the disc standing on its side here and a cross cut of it, and you can see those layers that go round and around here, and the nucleus inside there, and then this is another view of the disc too. And the hollow part in the inside here is where the jelly or the nucleus propulsus goes. But you can see how there's layers that go round and round, and the disc is really it's a brilliant design because it allows for movement in the spine. And you have these really strong vertebral bodies, and if they were right on top of each other, they would cause crushing kind of injury every time you bent or moved. So you have some cushion in between those vertebral bodies, and that allows you to do all sorts of movements, bending forward, bending backwards, tilting to the side, and then even rotational type movements. Unfortunately, the disc itself can become injured, and sometimes the what we think causes injury to the disc, well, it can be trauma that occurs from within the disc, and so that might be a nutritional deficit, pH changes, lack of oxygen. Those kind of things can cause trauma internally where the disc is not getting the blood supply or the nutrients that it needs. It really doesn't have a great blood supply, the disc, and so it gets all the nutrients it needs by kind of passive diffusion. So things are just diffused into the disc. So it's very unique in that aspect. There's only a few items on the body that are like that, where your bones themselves have a really great blood supply. And so the vertebral body has a great blood supply. It diffuses nutrients into the disc. But the disc itself can get injured from a lack of nutrition, those kinds of things. But stress also causes problems. So one of the things we know that causes a lot of disc injuries is smoking. Another thing is people who carry too much excessive weight puts extra pressure on the disc and causes problems for them as well. And then we also think soft drinks might be a causative source in disc problems as well. So those are things that you potentially might avoid if you already have disc problems. Quit smoking obviously will help you in a lot of different ways. External stress can also cause disc injury, and so that might be heavy lifting, twisting, bending. Any of those sorts of things can damage the disc. And sometimes people will say, "Oh, I felt a pop in my back," or sharp pain right after I did a certain movement or lifted something. That could be associated with a disc tear. An MRI is probably the very best imaging tool that we have to see a disc tear, but like I say, you can't always see a disc tear. There's something else called a discogram or discography, where we place a needle right inside the disc, inject contrast in the disc, and you can see what the morphology of the disc looks like. So you can see if there's degeneration inside the disc, or you can see if the disc itself has a tear. You'll see the contrast actually leak out. And then you can talk to the person too. It's called the provocative discography. And so they will tell you, "Oh yes, I can feel my pain. When you did that, oh yeah, I felt a sharp pain in my back, or I felt it go down my leg." And sometimes when those disc tears, the inside part of the disc can leak out. And if it leaks out, it'll irritate those nerves that are in the back part of the spine, or even the nerves that go down your legs, like the sciatic nerve. So you can get those radiating type of pain from disc tears. There's really what we think of as 3 different kinds of disc tears. One would just be peripheral disc tears. I'm going to show you this little picture again. And those would just be small tears that occur on the outside here. And again, that's probably from stress. Another would be concentric tears, and this is really what we think from trauma, and it's when these inside layers kind of rip apart. And so concentric means round, and so those layers rip one from the other. And then the other one is called a radial tear, and that's where you get a tear that happens in the inside and works its way all the way out to the outside. And the radial tears, oftentimes, any of those tears can be painful, but the radial tears is where we think this inside material leaks out and irritates those nerve roots. Now the question is, what kinds of treatments can you do for a disc tear? And there are a couple different treatments. One of the things that we always talk about in pain medicine is trying to diagnose what is the source of the pain, and then if you find the source of the pain, like we really know it's this disc tear that's causing your pain, then it makes sense treating that source of your pain. So different things that we think about. In the past, there was a procedure called Idaite, a minimally invasive procedure. We still use it. It's not paid for by a lot of insurance companies, but I think it's a good treatment. Basically, it's introducing a needle inside the disc. A little catheter wand goes inside the disc, and then that heats up. And basically, it cauterizes or cooks that collagen, the outside annulus layer of the disc, and it seals those tears up. So the disc has a chance, instead of leaking, that wall is closed back up so the inside layer won't leak out. So that is one treatment that I think can be very beneficial for a lot of people. There's another treatment. This is in the research phase right now, so it's not widely available, but it's fibrin glue. And it's injecting that glue directly inside the disc, and the idea is that glue kind of leaks out and stops there in the disc, and it will do the same thing, bridge that gap. So that we're still waiting for the results for that before it becomes widely available to the public. Disc tears can also lead to disc protrusion or disc rupture or herniation, so that's another thing where maybe it started with a disc tear and now it's moved beyond that. Disc replacement is something that many surgeons are doing. Again, that's kind of in its infancy, and so we think that it might spare some movement in the spine, getting a new disc, rather compared to a fusion, which stops all movement of the spine and would prevent that disc from compounding. This would allow for some movement. Again, that's it's a significant surgery. There have been some successes with that surgery, though, and that might be something that proves to be really useful in the future with these kinds of injuries to the disc. The other thing that we do oftentimes is treat the symptoms. So like epidural steroid injections might be a treatment. And for some people, if their disc flares up once a year or once every couple of years, an epidural steroid injection might calm things down, and they don't need any specific other treatment beyond that or any kind of big surgery. Disc tears themselves can heal up. It's not really known the incidence of those people who get them and how often and frequently they will heal up. Like I said, there's not a great blood supply or nutrition to the disc itself, so it's very difficult for those discs to heal up on their own. Well, that is all about annular tears, what we currently do for treatment, how the pain affects somebody's life, and kind of the anatomy of the disc itself. I hope that's really educational and beneficial for you. You can learn more at arizonapain.com or paindoctor.com. Thanks so much.